There's just been a lot of concerns about fluoride, what it potentially could do or could be doing to our children.
A national debate, now a talking point here at home. Good evening, everyone, and welcome to News 2 at 5. I'm Bob Mueller. A movement to remove fluoride from public water supply is gaining traction in Williamson County. News 2's Audrey Mayer spoke with a county commissioner who wants to show official support for the idea.
Tonight, Williamson County commissioners will decide whether to show support for a bill moving through Tennessee's legislature, which would ban adding fluoride in public water supplies statewide.
There's concerns about the potential harmful effects of fluoride.
Williamson County Commissioner Greg Lawrence says while the commission doesn't actually have control over the county's water supply, he's trying to win support for the proposal. Health experts say communities have added fluoride to public water supplies for decades, but Commissioner Lawrence says now there's plenty of other ways to get it, and he thinks people should have a choice.
If you're a municipality putting it in a water supply, you're basically forcing everyone to ingest fluoride whether they want to or not.
According to Dr. William Schaffner at Vanderbilt University Medical Center, small amounts of fluoride can strengthen the enamel in our teeth, prevent tooth decay, and reduce cavities. He says fluoride can be especially beneficial for underprivileged communities and children growing their first teeth who aren't brushing as frequently.
I would think something that we have done across the country very wisely for a long time, that's supported by all the dental professional groups, is something we ought to look at very carefully before we stop doing it.
But Commissioner Lawrence tells me he's skeptical of fluoride's benefits, pointing to the city of Spring Hill, which he says stopped adding fluoride to their water supply 15 years ago.
The evidence that it really improves the incidences of cavities it seems to be pretty sketchy. And there's been some studies that came out last fall that says that fluoride in water could be lowering children's IQ and it could be harming pregnant women.
Dr. Schaffner says the American Dental Association has looked at those recent studies and still recommends adding fluoride to public water supplies.
These were frequently studies of much more fluoride than we use. So that's the issue. You really have to look very carefully at the dose.
And Commissioner Lawrence told me he expects the commission to pass the resolution in favor of removing fluoride at tonight's meeting, which starts at 6 o'clock. Bob?